Yes, I have sent you the question paper. You can go through the question paper. Yes. Place the question paper in front of you. This is the first part of the first page. Second half of the first page. Second page, first half. Writing task. Writing task. Okay. Right. Now let us see some important things here. You have to assess. Okay. What type of letter this is? Okay. Now based on this one, we'll see what type of letter it is. You have to study this one very carefully. Yes. All the professions can watch this one, no problem, because I'm teaching you grammar, vocabulary. So here there are two important things that you have to notice. So what type of letter it is and what you are expected to do. Fine. Patient. What you are expected to do. So there is a doctor here and you're writing to some specialist. Okay. You're writing to some specialist. Okay. And this is a lady. Okay. Right. Right, there you go. You have the letter. You're going to write regarding Mr. Adam Knowles. And this is OET writing. And it is for medicine. So Mr. Adam Knowles is the name of the patient. So that's very clear. And this is a medicine specific writing task. Now let us see. What are the important aspects? So let us start from here. Adam Knowles is very important. Yes, Adam Knowles is very important. Next, his age is also there. When age is there, give importance to age. When age is not there, then consider date of birth. Okay, these are the two things which are very important. These are the two things. I'm teaching individual sentences, that's all. I'm teaching individual sentences. So these two things are very important. So you'll be using these two things like this. The regarding Mr. Adam Knowles, aged 68. This is one sentence which you are going to write. So simple as that. Regarding Mr. Adam Knowles, aged 68, and between there is a comma. In between there is a comma. So follow that one. You will never do a mistake if you follow this system. These systems are very important. There is no doubt that you will do any sort of mistake. So never do any sort of mistake if you follow these things. Fine. So number one. So this is called, so this is point number 4. The subject line. The subject line. So in the subject line, okay, you're writing, okay, 3 things. Number 1, regarding means related to what? The relationship. Regarding. So capital R and small e, then put a colon. Then put a colon. Colon means one dot above the other. So next one is name of the patient. So this is what it is. Number 1, regarding colon. Number 2, the patient's name. Regarding or reference. Regarding. So this is the one. Next one is the patient's name. Next one is the age or the date of birth. These are the 3 things that are very, very important. So what you will do is, you'll just write like this. Regarding, okay. Yeah. Yes. So this is how you are going to present. There is no problem with this. Don't try to learn different things. Learn one thing and finish it off. Don't try to mess with different things. Or you can also write Okay. Fine. Date of birth. You can also take this one. Okay. This is the date of birth. So what you can do here is, the other option is regarding Mr. Adam Knowles, comma, DOB, okay, then space 22 August 1951. So that is how you are going to present. These two, anyone is okay. So both are okay. Both are okay. So you are using this format also is okay. So now this is very clear now. You can write the first one or you can write the second one. Okay. Don't write a 68-year-old man, a 68-year-old pensioner. All this, don't worry. These two forms are enough. Okay. When you are writing those things, you are doing number of mistakes because you don't know. Okay. No need to be showy. Present it properly. That is enough. So this is done. So that means if you've learned these two forms, enough. If age is given, write the first form, aged 68. If age is not given, then write a date of birth, colon 22 August 1950. Don't write the name of the month in numbers. Instead of August, don't write 08. Better don't do that. So this is one point. Okay. Next. So that is done. The subject line is done. Fine. Next. The salutation. Salutation is number 3. Salutation is number 3. It comes before the subject line. Before the subject line. Okay. Paste. Okay. So this is how it must be. Next one, salutation. Now let us go to salutation. Now, salutation, you have here, go to the ending. You're writing to Dr. Dev Desai. So you're writing the letter to Dr. Dev Desai. This is very important. So you'll get the point here. If the name is there, write the name. If the name is not there, write the profession. If the profession is also not there, then write a dear sir or madam. 3 types of salutation. 3 types of salutation. Number 1, the name of the doctor is given. So 3 types. Option number 1, name provided. Then, if the name is provided, then how are you going to write? Dear. Okay. If the name is provided, you will write like this. Okay. Number 2, name not provided. So if the, profession provided. Profession. So name is given, profession is given, both not given. Both not given. So then how you are going to deal with these things? Okay, here you will write, dear Dr. Desai. If the profession is given, name not given. Then you will say, dear gastroenterologist. Dear gastroenterologist or a dear doctor. Just write, dear doctor. Okay. And you don't know anything about anybody. We don't know even their profession, and it is others. Then write, dear sir or madam. So these are the 3 options you can use. These are the 3 options you can use. There is no doubt regarding that. Use these 3 options. So dear Dr. Desai, or a dear doctor, or dear sir or madam. Now let us see here. You can see here, Dr. Dev Desai. Then why did I not write Dev Desai? And why did I write only Desai? So already in the address, you have informed all these things. So once already mentioned, when you talk to somebody, you'll talk in short, you will not talk in full names. So you address them by their second names, not the first name. So Dr. and Desai. Dev is first name. Desai is second name. So use Desai. Dear Dr. Desai. So that's it. So you take the information from here. Sorry. Okay. There's a point in there. So what are you going to do here? So you have taken as it is from the writing task. Then you just write here, dear Dr. Desai. That's enough. Yeah. So this is what you are going to use. Fine. So you write dear, then you write short. This is called the title, doctor. Doctor is a title. If he's not a doctor, then write Mr. 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 Okay. MR. Okay. Then Mrs. MRS. Fine. Here also you see Mr. is there. Mr. Adam Knowles. So you don't know his profession and you know him by the name because his profession is not important here. So we just ignore all the other things and just write Mr. Next, if it is a married woman, write Mrs. And if she is a spinster, the opposite of bachelor, unmarried lady is called a spinster. So use Miss, M-I-S-S, Miss. If she is a divorced, separated, or single, separated from marriage, or husband passed away, something like that, then write M-S. M-S, capital M and small s. And if you don't know anything, okay, just write MS. Okay, fine. Next, this is the salutation. So 3, dear, title, doctor, DR, and Desai. Now, if Desai is not there, then you write doctor in full because you are addressing the person by his profession. Dear doctor. And you can put a comma there. Not compulsory, but if you want, you can put it. So the 3rd and the 4th are done. Next. Next one. Next one is the second one. So 4, 3, 2. This is the date. Now many people say we have to write the date first and then the address. And many other people say we have to write the address first and date next. I'm opening up that to you now here. Yeah, both are okay. Yes, okay. Both are okay. Yeah, I don't differ in that matter. Both are okay. But what is the accepted phenomenon? What is the accepted style? That is more important. Which should be written first? You have to notice. Now let us take, for example, the same letter. We don't want. Many other letters are there, you can see. I'm just showing you an example. So with this, so address first and date next. That's it. You can see there. Now all your doubts are cleared. Address first and the date next. So where is the compromise? Why should you compromise? When you know something is absolute quality, then why do you want okay quality? I'm also saying it's okay. Both are okay. But say, for example, when you go to a shop, there are medium grade quality, high grade quality, and ordinary quality. Branded quality and without non-branded quality. So when you see, there's a remarkable difference between branded clothing and non-branded clothing. So there is something called standard. There is something called quality. There is something called you know that speciality. There is something called which is the best. Now it is up to you to follow whichever you want. I'm giving you an example from the official example. So if you want to write date first, you can write, no problem. Okay. You're not going to get any marks or lose any marks. But overall quality is something different. That is called presentation. So there. And see, normally when you write letters also, address will be on the cover, date will be inside. Remember that. So first address, then date. So that is how it is. So now, don't just believe somebody if somebody says, okay, okay, okay. So, okay people, we are not okay people. We are special people. Remember that. Okay people only get sorrow, distress, and they will be upset because they want only okays. They don't want quality. Yeah, that's it. So now here, date is here. Assume that today's date is 30 August 2000. So this is the date that you are going to write. It's telling you, assume that today's date is 30 August 2000. So you have to write this one. So it is 30 August. So this is 2nd August. 30 August, yeah. So if the date is not mentioned there, you can come here and get the address date from here. This date may be from anywhere. It may be before, it may be after, like here, or it may be in the beginning itself or middle. So they say discharge date and admission date, all those things like that. And then it will be here only, just below the name. Here it is here. If it is not here also, it will be here. So 30 August 2019. So this is the date that you are going to take. So the date. Yeah. So this is given in short form, but you are not supposed to write like that. So you have to write 30, capital letter August 2019. You have to present like this. Don't write any other format. This is called the standard format. Many people say 30/08 2019, 08 30 2009, 30 dash dash 08 2000. There will be many different styles of writing normally, but internationally there is one unique format. Unique format. There are some styles called Mla style. I'll show you here. Review. So here you can see Mla style, how you are going to use the styles. Okay. Language association. Okay. Fine. Modern language association or something it is. Okay. So there, how you have to write is this is what it is. 30 August 2019. So write in this format only and don't write in any other format. That's it. Learn one. Why do you want to mess up with everything? One format, standard format, learn. Those who don't have standards, They try to take ordinary things. We are not that sort of person. Yes. Hello, Dr. Asher.
Hello, sir.
Hello, dear. Yeah, yesterday there was one doctor, Gina, okay? She prepared with me for only 10 days, night time. Okay, full night she used to sit and she used to do that one.
Okay.
She worked hard. In the beginning, she had a lot of problems, but she wrote the exam. Okay, she came for me for only writing and speaking. And in speaking, she got 420. And in writing, speaking, she got 420. And writing, she got 390. Okay. So,
That's good
what
to
I
hear,
am
sir.
telling is, if you follow a system, if you follow a tradition, okay, it is not like a normal people. It is something like special quality you are going to put. Then you will not have any problem. Learn only one style, one standard style. And that style you can trust. For example, normally when I want something, I go to one person. For example, vegetables, we go to one person only. Clothes, we remember only one person. Okay, barber, we remember only one person. That means we know that he's a standard, and once that standard is set, we don't want to change. That is the style.
Yes, sir.
So follow the standards, right? So,
Okay,
Dr.
sir.
Sidhu, I called you for asking you one thing. Do you understand what is quality and what is normalcy? Yeah, Dr. Asher. Hello.
Hello, sir.
Yeah, what is quality and what is normalcy? Do you understand?
Yes, sir.
What is extraordinary and what is ordinary? Do you understand?
Yes, sir.
What is the difference between the hero and the ordinary people? You understand?
Yes, sir.
OET is the hero. OET is the hero. Whatever happens, OET is the winner. OET is the hero. OET is the boss. OET is the grandmaster. So if OET is the grandmaster and if you want to be excellent, then you follow their style only, no? Why
Yes,
do you
sir.
want to follow Mr. Simon's style? Why do you want to follow Mr. Tom, Dick and Harry's style? Follow only one style. OET is the standard, okay? So follow OET style.
Yes.
That's all. OET has given number of examples. Follow those examples. Don't listen and don't believe anybody, whatever they say. Why my students get so good marks, excellent marks, is I make them follow OET. I tell them avoid using non-authentic materials. There are scores of materials which are not authentic. Not authentic means not trustworthy. Anyone can write a question paper, but whether it is solid question paper or not, because when I started correcting papers, number of mistakes I have noticed in number of writing tasks. Only in the official OET I did not find such mistakes. So why don't we follow the same style? That is important, right? Dr. Sidhu is there with you, Asher? Is Dr. Sidhu with you?
Yes, sir. He's there with me, sir.
Hello, Dr. Sidhu. Hello.
Hello, sir.
Yeah, Dr. Sidhu, I know you are very busy people, very hardworking people, and in the COVID, you are facing a lot of problems and strict duty, stern duties and serious duties and severe, complications you are facing and everything. But still, when you have decided, now you already told me shall we go for the 25th, sir, you asked me. So I told just wait, we'll see this mock test, what you have written, and then we'll decide. We'll take 2 days time and we'll decide. If I say okay, then you can go ahead, no problem. But only the thing is time is the constraint. If you don't give me time, I cannot help you much. So just to hold on. Right. So now, so here we go. So date, always write like this only. Don't write in any other form. So the date, the month in words, and the year in 4 digits, not 2 digits, 4 digits. Be careful. This is official standard. So don't deviate from the official standard. You will have to pay the price. Next, first one. This is the address. The address. Okay, fine. Now, where will we get the address from? Now, let's go to task, writing task. If you go to the writing task, you will find the address. So here, Dr. Desai, shortcut is there, but the full name you have to take. Full name you have to take, Dr. Dev Desai. So we don't need it. This is taken in the salutation, Dr. Desai, dear Dr. Desai. So this is important, but it will go into, salutation. Then this will go into address. Dr. Dev Desai, first line, gastroenterologist, City Hospital, Eastern. So this is it. Dr. Dev Desai, gastroenterologist, City Hospital, Eastern. Is there any other information given? No. So, Dr. Dev Desai, gastroenterologist, City Hospital, Eastern. So, 4 points. Actually, 5 will be there. Street name will be there, or town's name will be there, or something like that. It is 5. But here there are only 4. So, forget about the others. So, okay, Control C. So let us take this one. So you have 4 things here. So how are you going to segregate these 4 things? This is number 1. That is the name of the doctor. And this is number 2. The profession of the doctor. And this is number 3. Okay. The place or the location where he is staying. And this is number 4. Okay. 4 different things. So now how are you going to separate these things? Right. What you do is remove comma. No need comma. Then next remove comma. Push it into the next line. Remove comma. No full stop. So that is how you are going to present. First line, Dr. Dev Desai. Second line, gastroenterologist. Third line, City Hospital. fourth line, Eastern. For example, name of the street is there, then you can write the name of the street. Otherwise, no need. Okay. So this is how you can present these things. These four different. This is how you will go for address. Now this is our letter, Mr. Adam Knowles, writing for medicine. This is the address. Then this is the date. And this is the salutation. And this is the regarding line or the reference line. So these are the four different things that you have to follow. These come before the letter, the body of the letter. Body will be divided into 5 paragraphs. Forget that now. Before body, body, and after body. So these 4 areas are before body. And 5th one is the body of the letter. Fine. So the 5th one will be the body. So we are not bothered about the body now. Okay. So we are moving to the 6th part. Okay, 5th, 6th, 7th. 6th part. Okay. The signing off. Okay. The signing off. Yours faithfully, yours sincerely, that's. Yours faithfully, yours sincerely. So these are the 2 things which we can use. There are many other things, but we don't know all those things. Okay, fine. The signing off. Now here you are writing to Dr. Dev Desai. So you are writing to Dr. Dev Desai. So you know the name of the person. So there are 2 options. No, name, known. Then name, unknown. Name known and name unknown. Okay. So if the name is known, then what you are supposed to write? Yours sincerely. If the name is unknown, then write yours faithfully. Name is known, name is unknown. So you should know what you are doing. So do you know the name of the person, or you do not know the name of the person? Now here we know the name of the person, Dev Desai. So definitely you have to use the first one, that is yours sincerely. For example, the name is not given and you have to write to the gastroenterologist in City Hospital. Then you have to write, dear gastroenterologist, or dear doctor, whatever suits. Accordingly, whatever suits accordingly. You write that one. And then at the bottom, you say, yours faithfully. Normally, many people just go fast. I'm least bothered about finishing fast. I want to finish the best. So maybe I'll take a little time extra, no problem. But it should be the best. No doubt should be there for anybody. So it should be, the person's name is known. So if you're writing to Mr. Simon, then you have to say yours sincerely. If you are writing to the professor, then you should say yours faithfully, like that. Remember. Then the last one is the 7th one. the sender's particulars. The sender's particulars. This is also address. The sender's particulars. Many people just write nurse and close it off. Doctor and close it off. Many people don't know that you have to write these also. Because the other person, okay, requires these things. If he has to contact you back. Okay. If the address is not there, the letter he'll keep, then how will he contact you? So address is important. Fine. Here again, you have to write. Who is this? Now let us see. Write a letter of referral. So this is a referral letter. Remember that. This is a referral letter. This is a referral letter. Okay, remember that. And this is an urgent referral. Remember that. Urgent referral. What do you mean by urgent referral? Its immediate action is needed because of the intensity or the severity of the situation or the circumstances or the conditions of the patient. They are very serious. So immediate action is required. Then you write an urgent letter. Remember that. And whenever you say urgent letter, the present situation, the present days report is more important. The present situation is more important because today's, in an urgent situation, you cannot talk about the past. You should write about the present in the beginning because present is the problem more than anything else. Okay. Right. Then next, last. So here you will not get anything about yourself. So what you have to do is you have to go forward. Who are you? Who you are? You are a doctor. You are a doctor. You are a doctor here. So then in a city clinic, okay, you are working in a city clinic, and Mr. Knowles is a new patient in your surgery. Okay. So, doctor in a city clinic, Mr. Knowles is a new patient. He's a new patient for you. Okay. It's first time he's come to you. First time he has come to you. It's an unknown patient. And the other person also whom he is receiving now for urgent assessment, he is also. So both you can see for both the people, the patient is unknown. Okay, they were referred by somebody. Right. First time they are visiting, that is what a first time visit. Now let us see here. Next, surgery. So here much information is not given, only doctor is given. Okay, surgery is given and city clinic is given. Right. If you can get some information, you can write. Name of the hospital will be given. Okay. Then you can write. If it is not given, leave it. Right. So this is the one. So yours faithfully, doctor. Okay. Which surgery this one? What type of doctor are you? Okay. So you are sending him to gastroenterologist. So you are a normal doctor. City hospital. Doctor, a gastroenterologist at city hospital. Okay, fine. Listen, same thing here. Right. Anything additional information? Gastroenterologist. Okay. So here you are asked to do the assessment. So this is the point. Assessment for what? This is the purpose. This is the purpose. This is the type of letter. Referral, green. Green is the type of letter, and this blue or whatever color it is the purpose. And this, so he is sent for assessment. For assessment. So this is for assessment and endoscopy, both. For assessment and endoscopy. So you're referring him for assessment and endoscopy. See there, another point has come. So if you take only the writing task, you will miss that. So normally people will take only this one for assessment. Requires assessment, finished. But here if you go in the plan for assessment and endoscopy. So here also you have seen referral. If you go here, it is an urgent referral. See, the words will be added from some other places. So you should know, okay, from where to get. So this is a referral letter, but this is an urgent referral. If you go here into the plan, you will get it. Yes, you can use same format for everything. All the professions common, only the letter is different, but everything is the same thing. Yes. So assessment and endoscopy. So here, if you take only this one, you will write only for assessment. If you take here, you will get another one for assessment and endoscopy. So now here, you have to mess up all these things together. So now you are going to write, okay, address, we have finished with address. So we have finished with address. Address is only one thing here. So doctor, that is the first line. And doctor, then hospital, city hospital, and the name of the surgery, department of surgery or whatever it is. So here these are not there, only city hospital, a city hospital he told. So city hospital, not the city hospital. So that's why these are not important now. These are not important because if he gives the name, they are important, green. So only doctor is enough here. And surgery, you are working in the surgery in the city hospital, or you can say city hospital surgery. But you don't know whether that only one city hospital. The name of the hospital is not city hospital because a city hospital is told. Not clear. So forget that one. Just writing doctor is sufficient. So we'll move to the main part now. So our regular students, Dr. Asher. Once again, I'm getting back to you, Dr. Asher. So because others have come to learn, but you are the regular students. Dr. Asher, is that everything clear to you?
Yes, sir. It is clear, sir.
Any doubts?
No, sir. Till now, no doubt, sir.
Okay. Let's move on to Sidhu. Hello, Dr. Sidhu.
Yes, sir.
Is that clear to you?
Yes, sir. It's clear, sir.
Any doubts?
No, sir. If they have mentioned name of the hospital, then we have to write below the yours sincerely, right?
Yeah. So now here, what I tell you is follow the standard. OET
Yes,
is correcting you, not somebody else.
Yes,
There are
sir.
many doctors who are teaching doctors, but doctors can do treat the patients, but doctors are not trained to teach English. Okay, they are doing, it's okay, they are doing, but they are not certified teachers. They are certified doctors, but if you ask them, do you have any certificate for teaching? They don't have. They don't have certificate for English. English teacher requires 2 certificates. One is certificate in language, and second one is certificate in teaching. That means he should be a master's in English and he should be master's in education. So that is what is the problem. So
You're absolutely right, sir.
there are many people. See, for example, forget I am not a doctor, but if I go take a knife and start cutting off somebody's arm and I say I'm doing operation, somebody is in the operation theater and I'll rush inside and I'll take a knife and start operating, they'll put me in jail, right?
Yes, sir.
Why? Because that is, they consider life of person is very precious. So they say you are going to kill him or harm him. But what about these false teachers who are teaching? They don't have certificates. I'm talking on the YouTube. I'm talking on the internet. I'm talking everywhere. This is a challenge for anybody. So what about the many people who are teaching? See, for example, okay, doctor can teach, but at least he should have certification for teaching. They can take a course for teaching. They'll know what are the essence of teaching. Just by practice like that, they will be a mentor, but not teacher. Somebody who can guide you, but not 100% right, because he himself doesn't have the quality. So, but many people go on teaching, and people, these poor nurses, they're blindly following them and they're going and paying thousands and thousands and thousands. And afterwards they come out crying and say, we did not get the result. So that is what it is. And nobody talks anything about these people. I don't know. So that is not our problem, but still those whoever, okay, learn properly, they'll get the quality. Go to the proper trainer. I'm not telling, don't come to me. I don't want students. Students need me, they come. That's all. I don't recommend any students, please come to me. They just come, they find out and come. So, how did you know about me, Dr. Ashir?
Sir, I saw a YouTube video, sir. From there I got to know.
YouTube video. Did I call you to come and join me?
No, sir. No, sir.
Just like that, you saw in the YouTube video and you felt, what did you feel?
That I feel you teach us very patiently, and the style of your teaching was very different, sir. So I thought I'll approach you and ask, sir.
Yeah. You saw many doctors also teaching, right?
Yes, sir.
Many doctors are teaching online.
Yes, sir. Yes, sir.
So what is the difference you have noticed?
Sir, the way you teach is a little bit different, and you have a lot of patience, sir.
Yeah, more than patience, I have a lot of love to my students. So you got me the wrong way. I have patience more because I have love abundantly. You understand now?
Yes, sir. Yes, sir.
You caught the small ball, but you are not seeing the big ball coming behind it.
Yes, sir. I think I missed it.
I'm throwing one tennis ball. Okay, it's a table tennis ball, and behind that a football is coming, and you caught the tennis ball, seeing the tennis ball, but behind that one is a football coming and hit you. You understand now?
Yes, sir.
So the point is, more than my patience, the love towards my students, that is more important. If I don't have love, why should I have patience? Correct?
Yes, sir. Absolutely.
That is more important than love, patience. Okay, so coming to this point. And you called 2 of your friends and you wanted to join, correct?
Yes, sir.
So when you find something good, you pass on information to others and they also join. So everyone is enjoying, right?
Yes, sir.
Okay, but do you feel that I'm like other teachers who take things lightly, or I'm seriously following you?
You are seriously following us, sir.
But you are slipping out of my hands.
No, sir.
Sometimes because of your duty schedule, what to do? Correct or not?
Yes. Yes, sir. Sometimes we.
So, right. So let the father hold the son's hand, lest he will be lost in the exhibition. You understood what I told you?
Yes, sir. I understood.
Let the teacher catch the hold of the student, otherwise he is lost in the world.
Yes,
I have
sir.
changed everything. Okay, fine. So that is what very important. Okay, fine. Now, these are the 7 different things. Let us recall so that we can go into the body of the letter. Yeah. So this is Mr. Adam Knowles writing for medicine. Next, the address will come first on the top, at the top. At the top. There's a difference between at the top and on the top. On the top means top is here on the top. At the top means at the top. So there's a difference between. So prepositions also when you write, you have to write very carefully. Okay, 4 lines here. Dr. Dev Desai, gastroenterologist, City Hospital, Eastern. And the date 30 August 2019. Don't write anything else. TH also is not needed. Nothing is required. Just write it in a standard format. The next one, Dr. Dev Desai. So it is dear Dr. Desai. Then regarding Mr. Adam Knowles, aged 68. This is talking about age. If age is given, write age. Age is the first priority. Then if age is not given, write the date of birth. Date of birth is the second priority. If both are given, better to write age. Okay. So, comma, date of birth, colon, 22 August 1951. So both are right, both are acceptable, no problem at all. Write in a single line, better. So next, the body of the letter we are going to follow. Then 6th one, the signing off. Name, known, yours sincerely. Name, unknown, yours faithfully. If you know the person's name, so here Dev Desai. So you will write yours sincerely. You don't know the name of it, it's just dear gastroenterologist or dear doctor, whatever you want to write, you can write. And then you say yours faithfully. Name is known, sincerely. Name, sincerely. No name, name, sincerely. Profession, faithfully. That's all. Name, sincerely. Profession, faithfully. Nurse, doctor, physician, or physiotherapist. Whatever you write, profession, and it is faithfully. And the last one is the address. Last one is the address. I put it in yellow because it is not given green. Okay, so that means it is not given clear picture, just to give an idea, that's all. Okay, there is no meaning in that one, giving also unnecessarily. There is no use. Okay, right. Now coming to the point, body of the letter. So this body, what I'll do is I'll take here. Yeah. The body of the letter has 5 parts. First one is the introduction. Second one is the body, paragraph 1. Body paragraph 2 and 3, and then the conclusion. So body paragraph 2 and body paragraph 3. So 3. Right. Now, body. Body is divided into 5 paragraphs. The introduction, the BP1, the BP2, and the BP3, and the conclusion. So these are the 5 paragraphs you are going to write. Fine, in the 5 paragraphs, what you are supposed to write? The introduction. You are going to write the introduction. So, first one will write 5.1. Okay. 5.1. The introduction. Introduction. Now, in the introduction, what must be there? So, the name of the patient, the name, okay, of the patient. Number 2, the name of the patient, the type of letter, the manner or mode of presentation. Number 4, the present conditions, the present circumstances. Number 4, the future expectations. Okay. This is called the purpose. So what for you're saying? Okay. The name of the patient, the type of letter, the manner of presentation, the present conditions, the future expectation. I'm showing you everything here. These are the 5 different things that you are supposed to write. The 5 different things that you are supposed to write. So note down, please, because this is very important. You get 3 marks for this. Fine. Write down. Makes the short notes. Simon. Okay. Yeah. Case notes. Okay. Fine. Yeah. Very clear till now. So we're going to put all these things into one solid presentation. Okay. Fine. Yeah, here you are. So always try to write in quality check paper. Okay. Always try to write in quality check paper. Take the second page and the third page prints. Second page and third page. Okay. You take them. And then write in this one only. Okay. So leave the first line. No problem. Leave the first line. And here. File. Yeah. File. Save as. Dr. Desai. Adam Knowles. Okay. Books. Okay. Mr. Adam Knowles. Urgent referral. Urgent referral. Okay. Right. I saved in a different thing. Now, what you are supposed to do is write in a straight line from top to bottom. Start from here always. Many people don't know how to write. They don't even know how to write. Okay, they write it in a half-hazard and dirty way. So from here to here, start from here. You are supposed to start from here, this point. This is the point you have to start. Some people start from here and they write like this, write something like this. No good manner of presentation. So be careful. Okay. Right. So we are going to start from here. Right. Start from here. Fine. Now what are we going to write? Now we know what we have written here. Okay. So I have shown you mostly everything. This is anyhow. Yeah. Here it is. Fine. The same things will bring forward. We've done a lot of work already. So here it is. Yeah. So start from here, this corner. Dr. Dev Desai, gastroenterologist, City Hospital, Eastern. Finished. A little early, Dr. Ashir was telling, sir, you have a lot of patience. Yeah, I have to have. But mostly many students don't have the patience. That is the problem. Okay. So they just want to have fast food ka zamana. This is the generation of fast foods. Good, no problem. So Dr. Dev Desai, gastro, and see the beauty, how it looks like now. All the things in one line. They are maintained the proper margin systematically, and how beautifully it looks like. So present like this one. Okay. Always present like this. So this is what you have to do. Then next one. Next one is leave one line here. Don't write anything in this. Okay. Leave one line. Leave one line. Finished. Then next here, you have to write the date. The second one is the date. Yes. With or without comma. Write the date. Finish. Leave again one more line. Leave one line. Okay. And next here, the third point. Go to the third one. Dear Dr. Desai. Just put it there. Okay. Then again. So next, fourth. So anyone you can take. You can take this or you can take that. Anyone you can take. This is I am putting in brackets. That means this is also right. Yeah. So this is also right. Regarding Mr. Adam Knowles, age 68, or regarding Mr. Adam Knowles, comma, date of birth 28 to August 1950, and that is also right. Then next. Again, leave one line. So 4 things over. 1, 2, 3, and 4. All the 4 things finished. Done. Yes, coming. 4 different things. 1 second. So 1 second. So 4 different things. So now next one is. Okay. Yeah, in the class. No, I don't eat anything. Morning I had some break for lunch. That's enough. Now I have some biscuits. That's okay. I wanted some tea, but I don't think we can have tea now. Nobody's there. Nobody's there to get for me. I'll make some black tea. No worries. No problem. No problem. No problem. Most probably, my wife will be coming next month, first week. Here. My children, they said they will come by car, but I said no, don't come by car. I'll send you tickets, flight tickets. Okay. Then you have to help me. Okay, so. Okay, so regarding Mr. Adam Knowles, date of birth 22 August. Okay, fine. So these are the points. Next, what you have to do is So this is the body of the letter. So forget the body, excuse the body now. We are not bothered about the body. Fine. So the body of the letter. We are not bothered about it now. So we'll see that later. We'll see that later. Okay, fine. Okay, next. Right. Next one. Here, dear Dr. Desai, name is there. So sincerely will come. So we'll take the word. Yours is sincerely. So that is it. Yours sincerely. Always start from the margin. Top to bottom, it should be straight. Remember that. Then again, you have to leave one line. Yeah. Leave one line. Okay, fine. Next one. So only doctor you take, others no need. Okay, because he did not give clear picture. So doctor, finished. Now this is how you have to write. Finished. So this is number 1, 2, 3, 4, 5, 6, 7. This finished. This follow that one. Now you have learned, no confusion regarding that one. Every time you apply the same things, it's very easy. So you learn all these things perfectly well. So you can concentrate more on the body because it varies. That is more to be concentrated. So you have learned this one. So no tension regarding these things. That's an end of this session. No need to repeat this one at all because it's always the same. So clear for all the letters. Now you only need to concentrate the body of the letter. Right. Now body will write in here, second page. Body of the letter will take here. Sorry. Right, body of the letter. Fine, what are the 5 factors? Now let us take there. We already saw this body. These are the, sorry. These are the 5, sorry, body paragraphs, 5 paragraphs. Okay, fine. Now, this introduction. These are the okay. These are the 5 different things that we are going to worry about now. So these are the 5 different things. So 5 different things. The name of the patient. Now instead of the name of the patient, what we are going to do is we are just taking this one. Okay, fine. There, the name of the patient. In this place, okay, fine. Let us do here itself. The name of the patient. We have taken one file. So yeah, we have duplicated. So the name of the patient is what? What I am doing, same things you do, name of the patient. Okay. Just take from here, copy text, and put it there. Finished. That's all. The type of the letter. The type of letter. Go here. This is the type of letter. Copy text. Put it here. And next one, the manner of presentation is urgent referral. Copy text. It's urgent. Urgent. The manner, the style is urgent. Manner of letter, urgent or not urgent. Then next one, the present conditions. What is the present conditions? Yeah, present conditions. This is 2nd August. Okay, see where is the present condition? Full example formed. Ordered FPC. 30th August. Yeah. No improvement in reflux systems. Patient's main concern is now back pain. New symptoms: diarrhea, pale stools, abdominal pain on eating, fatigue. Weight 2 kgs down since last appointment. Abdomen tender and palpation. Slightly swollen, yellow discoloration skin. So this is the pathological report. You can see here. So pancreatic malignancy. Possibility of pancreatic malignancy. Okay. Right. So that is it. Patient aware of possibility. So possibility of pancreatic malignancy. You can see this one. Okay. Then next one, future expectations is here for assessment and endoscopy. Copy. Okay. $54. Yeah. Right. So now you can see some points like this one. You can, based on this one, you have to talk. So write the sentence. So now try to write in passive voice as far as possible. Because officially, I'll show you. Many people think, why should we write? Everyone is writing like this. Okay, everyone is eating fast food, means you don't eat, na? One time it's okay. Okay, fine. Active or passive in OET writing. Just type like this and you'll get now. Why you should use the passive in writing? Is asking you why you should use. Do you know how to write passive forms correctly? This is one. I'll give you the links. Okay. Open link in new window. Okay. If you see the official OET, this is the official OET website. So you can save this one. Okay. I'll send it to our group. Okay, not now. I'll put the links in the Telegram afterwards. This will take time. So here it is. Okay. Right. Why it went only to Priya Chandran? Okay. This is the link. I have put the link there. Do you know how to write passive forms correctly? This question is asked by OET, official OET. www.occupationalenglishTester.org. So here you can see. And you can see I'll increase the size. So passive forms are great for making the patient or treatment the focus of a sentence. Try to understand what he is telling here. Using it during writing and speaking subtext can help your language be more sympathetic. That means you are more concerned about the patient. You are saying, I want to suggest you. I want to suggest you. Why are you giving importance to yourself? Some suggestions are required. Finished. Why do you want to bring I in front there? That's the point here. It shows that you are boasting about your greatness. It doesn't give importance to the patient. You should take some measures. No. Some measures are required. Finished. So, many people don't understand the importance. Can help your language be more sympathetic. Sympathy, apathy, all these words. As nurse or as doctor, you can use your language to build better relationships with patients. So when you are sympathetic, you will build better relationships with the patients. So instead of pitting the performer who is doing the action, passive voice makes the person or thing being acted on the subject of the sentence. Okay. So when to use passive voice? That is one point I have given. I'm putting it on the Telegram channel also. Okay. There it is. The Telegram channel, I have put a lot of links. How to write. How to write. Do you know how to write? That's what he's telling you. The official OET. Because directly teaching the letter, there is no meaning. First of all, learn passive sentences. How to write passive sentences. Okay. Now, then when to use passives? Using correct verb tenses. See, all this related. Then next. Here, why should you use passive? There he is asking, do you know how to use? Here is asking why you should use the passive. Why should you use? Why? What is the need? Why you should use the passive in your writing? I showed Mrs. Carter how to self-inject insulin. I showed Mrs. Carter how to self-insulin. This may be a very true statement, but when reporting the action to a colleague or another healthcare professional in a formal letter, it is better to make the patient more important to you. Why are you giving you importance? See bold letters. See the bold letters. Are you the only person who can show the patient how to self-inject insulin? No, even somebody else can show. A nurse can show, a doctor can show, a friend can show, a guide can show, a head nurse can show, a nurse in charge can show, a ward nurse can show, anybody can show. Not only you, anybody can show. He can learn on his own also by watching the YouTube. Nowadays, everyone is learning. Everyone is learning something or the other. Okay. Just by watching on the YouTube, they are learning many things. I'm sorry, I go on for hours together, so I have to wet my tongue. Okay. Right. Will you show them a different technique to the one another colleague would show? The next one. No. To your reader, the showing is more important than who did the showing. I recommended Mr. Knowles insulin injections. Okay. Why do you want to say I? Don't do that. So the showing, okay. To your reader, the showing is more important than who did the showing. So avoid I. Who performed. Performer is not important. The performance is important. Who is playing football is not important. Football is important because you love football. Anybody plays football, you'll go and watch. Of course, the hero of the game plays, then definitely you will not miss the match. That is different thing. But if football, even children play, you'll stop and watch. That is the thing. So performance is important. Performer is not important. For this reason, passive forms are often used to make the person doing the action less important than the person they are doing it to, or even the action they are doing. So don't even name the patient also. Insulin injections are recommended. Finished. I recommended Knowles insulin injections. I is not important, Knowles is not important. Insulin injections and recommendations are important. Insulin injections are recommended. That's all. Be simple, be passive, use passive, and be qualitative, present qualitative sentences. No need to write this much. Okay. Write quality sentences. Everyone wants to write the letter. Nobody wants to learn these things. What to do? When people give money, I start teaching them. Okay. When I start teaching them, Simon sir is wasting his time, wasting our time, they think. They don't know that I am wasting my time. Many people, they don't want to come to the session itself. They just says, no sir, we are writing so many letters where what nonsense you have written, we don't know. We don't know, it's nonsense. 40 mistakes in each letter. And you say, I'm writing letters, sir. Okay, learn before starting writing letters. And next, the patient was shown how to self-inject insulin. Self-injecting insulin was shown, was demonstrated, was explained. Education was provided to inject insulin injections. Education was provided to self-inject insulin. That's still awesome, even more than this. Education regarding self-injecting insulin was provided. Okay. Anyway, you can write. So this is another. Nobody will read all these things. Nobody will read. If you read, you will be benefited. If you don't read, no one is going to get any loss, only you. A blood sample was taken on Tuesday from Mr. John, also not needed. Blood sample was taken on Tuesday, finished. I took a blood sample of Mr. John on Tuesday. That's not supposed to be. Okay. The form of this sentence is also passive. It starts with the object, a blood sample. Then the passive verb was taken and all these things. Go through these things. I'm giving you the link here. Okay. Fine. There are many things like this. You can go through the official site and learn from there. So now you can write into 3 or 4 different styles. Okay. I am referring active voice. Why should you bring I? Mr. Adam Knowles is being referred. One second. So, right. ETF. Yes. So here it is Mr. Knowles is being referred. Full stop. So Mr. Knowles has come, referred has come. Okay. Mr. Knowles and referred both have come. Is being referred. Okay. I am referring, present continuous, active. Mr. Knowles is being referred, present continuous, passive. Passive sentence. This is passive sentence. Learn this sentence. Afterwards, you can add many things to this. Okay. Or you can write, I am referring. I am referring Mr. Knowles. This is active voice. This is okay, but quality is low. Quality is low. The manner of presentation. He requires an urgent assessment and endoscopy. And endoscopy. Just giving you some sentences. Endoscopy. It requires an urgent assessment and endoscopy. Full stop. Present conditions. What is his present conditions? You can see there. What is his present condition there? Pancreatic malignancy. Possible. Okay. Pancreatic malignancy. So, whose signs and symptoms suggest pancreatic malignancy. Pancreatic malignancy. Why you brought? Tomorrow we could have taken pancreatic malignancy. Don't go unless. Wait, please. Pancreatic malignancy. Okay. So this is dot. Or you can say Mr. Knowles Mr. Knowles in brackets. Okay, apostrophe, Mr. Knowles apostrophe. Mr. Knowles signs and symptoms suggest are suggestive of. Who signs? Mr. Knowles signs and symptoms suggest pancreatic malignancy. Afterward, change however you want. Then, future expectation. He requires an urgent assessment. So the same thing here. Purpose. Urgent is here important. So these two things came here. Assessment and endoscopy is the purpose. Urgent is the manner of the letter. So you can say like another sentence I'm giving you. Thank you for seeing Mr. Knowles. Thank you for seeing Mr. Knowles. Or you can also say, thank you for accepting Mr. Knowles. Okay. So these are some types of sentences you can use. You can join different things. What are the important things? Those I will tell you now. Important things are these. Mr. Knowles. Okay. Referred. Being referred. Is being referred. Or I am referring. Urgent. Okay. Assessment and endoscopy is the purpose. Okay. And signs and symptoms suggest pancreatic malignancy, suggest possibility. Okay. Thank you for seeing. Thank you for accepting. These are the different types of forms you can write. And based on this one, you can go. So, urgent investigation. Okay. So, this is the way how you can write. This is the introduction. Then, conclusion. Conclusion, you can write 2 sentences. Okay. Based on, okay. So for example, here I have given 1 sentence. Okay. Okay. I'm just giving you an idea of something. Okay. So based on the above mentioned circumstances, so I'm giving an idea, that's all. Regular monitoring, instead of regular monitoring, we can change this one. Based on the above mentioned circumstances, okay. Immediate evaluation, because urgent we say, so you can say here immediate evaluation of Mr. Knowles Knowles condition. Okay. So regular monitoring. Okay. Remove this one. Finished. So based on the above mentioned circumstances, immediate evaluation of Mr. Knowles' condition would be extremely beneficial. Then second sentence. Conclusion, 2 sentences will be there. Second sentence is, in case you require any additional information, please do not hesitate to contact me. Vincent, come, finished. So this is how you have to write. So this is how you have to write. So introduction and conclusion. I taught you how to write sentences. Okay. So body, then we'll discuss body. Okay. So Dr. Ashir,
Hi, sir.
was that clear to you till what I have taught?
Yes, sir. It is clear, sir.
Basics and general things, all I have cleared now. And we are going into the most serious thing that I will take in the second session. Okay.
Okay, sir. Okay, sir. Thank you so
So
much.
you
sir.
understood, no? Everything, the ordinary things and the mediocre things are cleared now. Then the body of the letter, how to write body and what are the compartment. Introduction also I have taught you. Conclusion also I have taught you now, correct?
Yes, sir.
So everything clear. Only the 3 body paragraphs, how to organize those things, I will explain in the second session. Give me your timing and I'll explain. Is that clear?
Yes, sir. It is clear.
Okay,
Sir.
Sidhu, Dr. Sidhu.
Yes, sir.
So fine. If you have any queries, you can contact me. You can message me.
Okay. Okay, sir.
Okay, fine. And I'm going to post I already posted this in the YouTube, and you can ask Dr. Kirtesh also to watch that one. Okay.
Okay, sir.
Okay. Any doubts regarding the current session?
No, sir. Till now, it is very clear, sir. It was very helpful, sir.
Okay. Thank you. And can you explain in your own words what difference this lecture made for you, Dr. Asher?
Sir, all the basic points which were
Yeah.
hello, sir. Can you hear?
Yeah, now I can hear. Come on.
Sir, during these 5 years, our English, we were not concentrating much on English, and we had lost lot of basic things which were really important. And this session cleared so many things, sir, for us.
Okay. Fine. Your presentation is very important. Okay.
Yes, sir.
Okay, fine. And Dr. Sidhu,
Yes, sir.
what is your gain in this session? What did you gain?
It was very useful session, sir, and we know we have to do some what you call improvements in this letter, and it is important to write in passive sentences, so we can give importance to patients, and it will help us to score in writing a letter.
Okay, fine. So your disease of English language or your style, you are coming to a language specialist, a language doctor. So the disease
Yes, sir.
which we have is not an ordinary disease. It needs a specialist, right?
Yes, sir.
So that is what I am doing. Okay.
Okay,
I
sir.
am doing some surgery, open heart surgery like that one I am doing for you. Okay. So
Yes, sir.
follow this one. And if you're confident in this one, and then you can give me the timing for the next session. My session normally will run more than 1 hour. I don't know how much time it took. I don't mind the time. What time we started?
5:30, sir.
5:30. Okay, it is 7:30. Normally it runs more than 1 hour because I teach lot of additional things which are more important.
Yes.
If somebody else was there, they would have finished this lecture in half an hour, fat, finish and go off. Okay.
Yes.
So for me, I'm not like that. I want you to know the best things. Okay. So write
Yes, sir.
all the things, whatever you learn, that you write best. What did you learn? Okay, no problem. Till now, whatever I have taught, in those things, I should not see any mistakes as far as possible. Okay,
Okay.
Sidhu?
Okay, sir. Thank you so much.
Okay, beta. Good night.
Good night, sir.
Good night, sir.
Good night, beta. And schedule second session and get back to me. मुझको send कर देना.
Okay, sir.
You send me your timing when you want the second session for writing. I will explain. And most probably I'll be calling you for the speaking sessions. If
Okay,
you
sir.
give me time, I'll call you. Unless and until you tell me your timings, I cannot call you. I cannot go on calling everyone. So just raise your hand there and you say, sir, I want speaking session, then I'll schedule. Like that.
Okay, sir. No problem.
Okay, dear. Okay, bye. Good night.
Good night, sir.